Hello friends, this is Jason Williams, DO. This is the Williams Family Medicine channel. This is for patients and healthcare providers that want to learn more about health span. My plan for today was to discuss low carb, high fat diet. For my patients that have obesity, metabolic syndrome, and even type 2 diabetes, a low carb, high fat diet seems like an obvious starting point to try to improve health. The diet itself is not complicated, but does need to be discussed in detail. When I begin, I talk with patients about our way of eating and how it has changed over the years. I talk about the 1977 Standard American Diet Guidelines, carbohydrate intake recommendations, and how this was a departure from our ancestral diet. I talk to them about the major macronutrients that are present: carbohydrate, protein, and fat. In that discussion, I reveal that carbohydrates are not necessary for survival, but protein and fat are. I discuss some of the beneficial effects of protein and fat on multiple processes in the body. We also discuss what it means to have a low carb, high fat diet. We briefly discuss definitions such as keto diet, paleo diet, Mediterranean diet, and some of the differences between these type of diets. Each patient will have a different recommendation based on their disease state and their stated goals, and we discuss that individually with each patient. In general, low carb, high fat diet consists of trying to ratchet down carbohydrate intake and increase fat intake. The protein intake is, for most people, not something that can be increased greatly. For a general target for patients, I talk to them about 60-70% of their total calories from fat, 25% from protein, and the balance from carbohydrate. And as I said before, this varies based on our goals and based on the disease state of the patient. When discussing this type of way of eating, I talk to them about specific food group choices, and then we also discuss the grams of carbohydrate in certain foods to eliminate some of their shortfalls in their diet presently. For example, we talk about eating meats, fish, eggs, butter, cream, vegetables except for potatoes, limited fruits except for some berries, nuts. All these type of foods seem to be beneficial for low carb, high fat diet. We talk about things to avoid that include ultra processed foods, foods that come in a box, convenience foods. We talk about sugary added drinks, and then we talk about the major culprits that cause people to groan: bread, pasta, cereal, those things that almost all of us like and have become addicted to, but they won't do us any good in our efforts to implement low carb, high fat diet. After patients have cried a little bit discussing these things, then we move on to talk about their specific carbohydrate goal. For example, in general, if I have a patient that is in danger, elevated blood sugar, significant risk for diabetic complications, I may have them shoot for a goal of 25 grams per day. On the flip side, if I have an athletic person who is doing fairly well and their health is not way off center, we discuss maybe 100 to 150 grams of carbohydrate per day. And then other people fall in between. I do stress the fact that patients don't need to count calories when they're implementing low carb, high fat diet, which is a relief and also takes a lot of the mechanistic stress off of trying to change a lifestyle and implementing a new way of eating. Most other diets do result in calculations and computation. The challenge with low carb, high fat diet will be reading labels if you have any foods that you're considering that have a label. In general, for healthy low carb, high fat diet, it's best to eat healthy natural foods, and most of these won't have a label actually. Whenever I implement low carb, high fat lifestyle with patients, even before I recommend they do this, we talk about contraindications to this way of eating. I give patients a handout that goes over some of these. Most of these contraindications are not relevant, but at least address this with them. I also tell them about what may happen when they start low carb, high fat diet. Many people have heard of the terms keto flu. I discuss the fact that insulin level will decrease when patients switch to this way of eating. When this occurs, you will lose salt and fluid at a much greater rate than your body is used to. This can result in palpitations, dizziness, weakness, muscle cramps, constipation. I discuss this so patients know what will happen, and then I also talk to them about ways to mitigate it with extra fluid, extra salt, even salt added to water. I give a handout that discusses specific foods they can take in that seem to help with mitigating these symptoms. Almost all people are deficient in magnesium. In the United States, if you look at population studies, I recommend using magnesium 400 milligram supplementation for most patients as well. If you have constipation, milk of magnesia seems like an obvious choice because it has magnesium in it. A certain caveat for people that are athletic: your exercise tolerance will likely decrease if you switch over to this lifestyle. This is temporary, but it can be a duration that ranges from weeks to even 3 months. If you plan to participate in some upcoming event that you've been training for, wait until after the event is over to start switching to this lifestyle, because you'll probably be frustrated with your athletic performance in the short run. After you have fully adapted to using this type of fuel for your energy requirements, you will likely perform at the same level or even better. There are plenty of elite athletes that use this way of eating and this lifestyle for their overall health long term. I tell patients that these type of symptoms, they last for days to weeks for most people. Of course, if you cycle in and out of this way of eating, each time you cycle back in, you could experience some of these side effects or symptoms. There are plenty of patients that don't have these symptoms. The other way to mitigate these symptoms is to gradually ease into this way of eating, which would be, instead of completely switching from 200 plus grams of carb intake a day to 25 grams, switch from 200 plus grams of carbohydrate per day maybe to 100 by just cutting out sugary drink intake for a month. And then the next month you ratchet it up and you cut out something in addition to sugary drinks, and so forth. For the majority of people, low carb, high fat diet can be very helpful for assistance with treatment for obesity, metabolic syndrome, and type 2 diabetes. It can actually put type 2 diabetes in remission. It's very common for people to lose significant weight, and there are many other benefits of this way of eating that I can discuss in a further video. Today was mostly about just discussing the low carb, high fat diet and how I advise my patients. So keep in mind that if you're not my patient, then this advice is medical information, but is not directed to be your personal medical advice. You need to see your own physician to talk to them about your personal health and any changes that you might want to make. So this concludes the video about low carb, high fat diet, and we'll have many more subsequent videos to discuss various topics related to this and other medical issues. So hang on for next video. Thanks for listening. Bye-bye.